Joshua DiBertoli has a rare and life-threatening condition called atypical hemolytic uremic syndrome, or AHUS for short. It's an autoimmune disease that causes blood clots throughout the body and attacks the liver and kidneys. But you'd never guess it to see him today. When Josh DiBertoli was diagnosed a year ago, he was bleeding internally, his kidneys were shutting down, and his face was puffed up from the prednisone he was taking for AHUS.
He was in a lot of pain, like moaning, crying pain, and kind of delirious.
But he was offered a chance to join a clinical trial for a new drug called eculizumab with the brand name Soliris.
The benefits of it appeared immediately. So that was very exciting.
It feels cold usually, just doesn't feel like anything. Maybe it's just the vein that it is in.
For the past year, Josh has been receiving a 45-minute transfusion of Soliris every 2 weeks. He's just started getting the treatments at home, and they've given the 11-year-old boy a new life. He's been ziplining, he plays soccer, and is learning karate again, and he's back to his grade 6 class.
Just keeps me healthy.
Doctors have told Joshua's family that he can continue to take Soliris for the rest of his life, much like a diabetic takes insulin. Soliris has just received Health Canada approval, but it's very expensive medication, $500,000 a year per patient. Because Josh was part of the clinical trial, the drug makers, Alexion, are continuing to provide him with the treatment until Ontario agrees to cover the drug. For other patients, insurance through their employers will cover the drug. And despite all their fears and anxious weeks last year, Sonia says they're actually quite lucky. There are other patients she knows who have lost limbs or even their lives waiting for this drug.
The most wonderful part of the experience was leaving sick kids with him. That day was amazing, because lots of people don't. So.
Soliris is a kind of drug known as a biologic. It's also used to treat another condition known as PNH. It's also been called the most expensive drug in the world, but for the DiBertolis, it's a lifesaver. With today's Lifetime, I'm Pauline Chan.